creative artists. A lot of them are actors and writers and people who did performances. They had a different relationship with their trauma than regular people who don't consider themselves creatives.
That is psychologist Cheryl Arutt, who specializes in trauma recovery and creative artist issues. Some variety and level of trauma affects most people, perhaps especially those of us who are creative and neurodivergent with intense nervous systems. This Creative Mind audio episode includes edited excerpts from her interview on the Eating Disorder Trap podcast. See the notes for multiple links and resources.
Welcome to the Eating Disorder Trap podcast. I'm your host, Robin L. Goldberg. Dr. Cheryl Arutt is a licensed clinical and forensic psychologist, certified EMDR therapist, and EMDRIA consultant based in Los Angeles. She is a specialist in the nexus between creativity and mental health and offers EMDR intensives and adjunct EMDR via telehealth. She is a passionate clinician who advocates for her clients who are survivors of trauma and currently is Access Hollywood's go-to psychologist for trauma issues and a frequent psychological expert on a variety of networks, including CNN. Lastly, Dr. Cheryl is also the founder of Creative Resilience, online education for busy creatives to find their voice and their power. So impressive, Cheryl. I think many people struggle to find their voice and to be able to use their power. So I'd love to know from you how you actually decided to specialize in trauma and creatives.
I decided to specialize in trauma and creatives because I think part of it had to do with my previous life as a creative myself. And then as somebody who had some trauma experiences of my own and people close to me, I got really interested in healing and how people move forward from things that are difficult. And what was really funny was that I left a creative field and became a psychologist specializing in trauma, and then all of a sudden started finding that the people who really felt seen and known and understood by me were creative artists. A lot of them are actors and writers and people who did performances. And I also found that they had a different relationship with their trauma than regular people who don't consider themselves creatives to be. And I found that interesting.
So one of the areas I know you're passionate about is polyvagal theory. And many of our listeners are not acquainted with that term and what that means. So maybe you can give a brief description of what that is.
Absolutely. Polyvagal theory is a new way of thinking about the autonomic nervous system. And we can think of the autonomic nervous system as like the automatic nervous system. It's the part that the things that our body does all on its own without thinking about it, like breathing and heart rate and all of these things. We've learned about things like the fight or flight response and the sympathetic and parasympathetic nervous system, where a lot of times people know that when they need to fight or run away from something, it's their sympathetic, and when they're relaxed, it's the parasympathetic. But polyvagal theory takes things further. It's a new understanding that started in the 90s with Dr. Stephen Porges. And it basically identifies that how we feel, especially how safe we feel, determines all kinds of things about what our bodies are doing and what kinds of programs our bodies are running inside. It's not even how safe we are. It's how safe our neuroception, our feeling of our body, tells us. And I think a great way to think about this is it's like there are two different software programs that our bodies could run. And one of them is the wellness maintenance program. When we feel safe enough, we do these great things like sleep deeply, and we're social, and we digest our food, and we have good immune systems. The other program, which is very expensive for our body to run, is threat detection, survival mode. And that involves not only fight or flight, but also freeze response, fawn response. There are all kinds of ways that our bodies go into survival mode. And what polyvagal theory, which is named for the vagus nerve, which is the 12th cranial nerve, and it goes wandering all through our body. And actually, it comes from the same term as vagabond, wanderer. That's why it's called the vagus nerve, not for gambling reasons. It's this nerve, based on how safe we feel, says, okay, let's chill out and digest our food and relax and be healthy and social. Or we need to survive right now. All that goes on hold, and we go into these various survival modes. And this has huge implications for our health and our well-being. And people who have trauma in general getting stuck in survival mode and not even necessarily realizing it, it's something that is involuntary, which is a really important part of this, that our bodies are trying to protect us. And our bodies don't think that we can afford to do all of the regular maintenance things that keep us well, because it thinks that we need to survive. And when people develop things like post-traumatic stress disorder, they can get stuck in survival mode. It's as if your body says, just in case, there's this orienting response our brain does to notice anything that might potentially even be a threat. And this time I'm not going to be caught off guard. This time I'm going to be ready. And it makes people hyper vigilant, and it makes you forget how to tell when you're safe. And certainly when you have an eating disorder, you are so preoccupied with food and have I done enough or have I done too much, and ignoring certain body signals like hunger and satisfaction. Very often, as you know, people aren't even enjoying and tasting the food that they're eating when they are eating. The disconnection from experiencing the body and enjoying being in the body is a very important part of both trauma and, I think, misusing food to try to manage those uncomfortable feelings. I work with a lot of people who have they may have a big platform or big lives, and they believe that when I achieve X, if I get this role, or if I get a lead in this, or my own show, or something, that's when I'm going to finally feel good enough, or I'll be able to relax, or I won't have these problems that I'm having. And then they achieve whatever it was, and they just kind of move the goalposts and go, well, why don't I feel all better? Oh, it must be because I have some other goal that I have to achieve. And it takes a while sometimes for people to say, maybe all this goal setting and preoccupation with that isn't making me feel the way I wish I were feeling. And maybe there's some other way to feel better. And that's when I tend to meet them.
So for those that experience trauma, Cheryl, what would be 3 suggestions or tips you would offer someone who's considered seeing a trauma specialist such as yourself, and they're like, I don't know if I want to bare my soul and speak about things? What would be tips or ideas that you would want to put out there for someone to consider moving forward?
Well, the things that come to mind is that, first of all, people who've experienced trauma tend to minimize their own trauma and think, oh, well, my thing is not as bad as somebody else's. And a lot of times people sit around and feel like they're not entitled to have their own care or help because it's not somebody else's. And Bessel van der Kolk talks about big T and small t trauma, which I think is really helpful to think about. The big T traumas are the ones we know are traumas, like, earthquakes, car crashes, crime victims stuff. But the small t traumas, being bullied, being neglected or criticized over time, and not feeling safe as a child, lots of things that we might not recognize as traumas can cumulatively back up on people. So there are things that people tend to struggle with taking care of themselves and feeling deserving of taking care of themselves and feeling worthy. So the first thing I would say as a tip is that you deserve to have the very best life that you can have. And whatever you think is your fault is probably not your fault. And shame makes people feel like covering and hiding, and nobody can know what's going on with me. But actually being able to find out that you're not alone and you're not the only one who's ever gone through this can be an incredible relief. That can look like support groups, that can look like therapy, that can look like learning self-soothing techniques. There are a bunch of ways with polyvagal theory of activating your parasympathetic nervous system, which is showing you how to tell how to feel safe. There are things like breathing exercises where you can breathe in for 4, hold for 4, and have a longer exhale for 8 counts.
It's very effective.
Yes, it looks like you know something about this.
Mm-hmm. I'm not an expert, but I know. So yeah.
These tools, we want people to have lots and lots of tools. There's breathing, which actually breathing is the only function that is both autonomic and intentional. So we can mindfully breathe like we were just talking about with the breathing exercise. But if we don't think about it, luckily we breathe anyway, right?
Fortunately, yes.
Fortunately, right? It would be really, really bad. So that's really the only function that spans between the automatic and the intentional. And when we intentionally breathe, it sort of hacks into that nervous system response and tells the body, you know what, it's okay. You can afford to do this. And it helps your body relax. So there are lots of skills that people can learn: breathing, meditation, yoga, finding sports or things that they like, learning about the nervous system and learning about the common responses that people have to trauma so that you don't feel so alone can be really helpful for people too, because, we see things in the movies about what like the perfect victim is or how somebody responds when something happens. Most people actually freeze. They don't even fight or flee.
Fight, flight, freeze. Yes, exactly.
Yeah. And then there's fawn where many women do this, where if somebody's kind of scary, a lot of times the survival response is to be really like not make that person mad at you and try to get them to see you as human and feeling and to make them want to be nice to you. And it may look like you're being kind to them, but it may be coming from a survival place.
Thanks for listening. See the Creative Mind post for this podcast episode with links to resources and other material.